All right, turning to our news coverage now. COVID cases continue to dramatically decline in California. It triggered the governor to end the statewide indoor mask mandate next Tuesday. But here in the Central Valley, it's not exactly seeing the same results. Our Medeiros Bab joining us live in studio now. Medeiros, health officials offering some positive news, however, today.
They are, Alexandre. COVID numbers are trending in the right direction, but local health experts predict that we're still a couple of weeks behind the statewide trends. The good news is that starting next week, across from Fashion Fair Mall, a new treatment will be available for those at highest risk.
We're here to get boosters for my young ladies who stay in my facility.
Betty Wesson owns a facility that helps adults with disabilities. For Wesson, it's important the women she cares for get a vaccination and booster.
So they are in the vulnerable category, first of all. Second of all, I think it's important to follow the science, and the science is recommending boosters.
Because statewide COVID cases have dropped 65% since the Omicron peak, Governor Gavin Newsom says come February 15th, masks will no longer be required for vaccinated individuals except in high-risk settings like hospitals, schools, and transportation settings.
We're in a better place.
In the last 2 weeks, the COVID test positivity rate and COVID-related hospitalizations in Fresno County have decreased around 10%. While this is the most significant drop the county has seen since the Omicron surge, Dr. John Zweifler says hospitals are still full.
A lot of people in the ICU. It's led to our EMS system still doing what we call assess and refer because the hospitals are so full that they just can't take more patients unless they're true emergencies. So there are still significant issues related to COVID in our community.
Dr. Kenny Bond with UCSF Fresno says because the testing and vaccine demand is going down at the COVID Equity site in North Fresno, come next week there will be a new monoclonal antibody treatment. This treatment is preemptive and is not for the general public, but for those who are allergic to the vaccine or are immunocompromised.
So this one's a little different than Regeneron because it's prophylaxis, as in it's like you're doing it while you're not infected, but it's to keep you from getting Omicron's long-acting monoclonal antibodies.
Bond says the site will start with around 50 doses of the monoclonal antibody treatment next week. Bond says while this new treatment is a good second option, he says the vaccine is still the best option to protect individuals from COVID-19. Reporting live in studio, Medeiros Bab, KC24, local news that matters.